Hi, I'm Dr. Larsen. Welcome to the video. I'm here with one of my new patients. He has some right jaw popping going on. He's about a teenager, and he's had some recent braces. So you had braces for how long?
A little under a year.
A little under a year, where it was how long he had braces for. It's July right now of 2019. He got them off October 2018, right?
Yep.
Maybe about 6 months ago, the right jaw popping and kind of clicking started to occur. But he also has some back pain about right through this region, and then he also has some ankle issues that are going on too, like popping and clicking in the feet. So I want to show something here with the braces and the retainers again, as you've seen on a lot of my videos. So when we check the feet, so hold down and then across that way. When we check the feet, he doesn't have any muscle control here, so up and in. So that one doesn't work either, but when we go to the outside, hold up and out, he's got full power there. He's perfectly fine here, and then push straight across there and there. But it's the ones that are in here, so tibialis anterior, tibialis posterior, it's what holds the arch up and makes that sling on the inside. Same thing is occurring on this foot. I won't test that one. It's pretty much symmetrical across. So I'm pulling out, you're pulling in here, right? So hold there. He's very weak here. This is one of the adductor muscles that attaches here, then up on the pubic bone. Doesn't work on this side either. What else do we have? Hamstring, kind of calf muscle as well. So pull back towards your butt there. These are very, very weak on both sides. Sartorius muscle, hold your heel there. I'm going to pull towards me. Again, really, really weak muscle. It attaches down here, it runs up through this region, up into the pelvis. So a lot of his stuff is on the inside here that's not working. Whereas if we check the glutes, at least the glute medius, push out, he's very, very strong there. So he's pushing out, I'm pushing in. Lower back muscles, hold both legs that way. Again, really weak, because he's losing that kind of core stability through here. Hold across. And really weak there. If we go through the upper body, he's all strong here. So hold tight to your side, and then push out. And everything is strong. Neck strong, right? Yeah, neck is strong. Everything's good, but it's everything from about here down. So he's got the metal retainer on the bottom, so go ahead and just kind of pull on that. So he's just going to hook it, and you just kind of put pressure on that. And all he's doing is stimulating the nerve fibers that hook into the teeth. So he's just putting pressure on there, right? So you put pressure there, pull both legs that way. I'm going to pull towards me, and it gets much stronger. We'll try to do the same ones I was doing before. Hold your heel there. I'm going to pull towards me. And this one gets really, really strong. It's a very strong muscle. Hold this leg that way towards your right side. And I'm pulling out, and I'm actually pulling a lot harder than I did before. I know you can't tell on a video. Probably think I'm not pulling as hard, but hold this one towards the window. Very strong as well. And then we have the two inside ones. So hold up and in. That's the tibialis anterior, like a shin splint muscle. Hold up and in. I mean, very, very, very strong. And then down and in. Tibialis posterior is super strong as well. And that's going to help hold his arch up. Now, it's not just the retainer. A lot of times there's more than one thing. So as he had braces on, braces compress everything. So braces will compress the yellow bones together right here. Okay? He wears a plastic retainer at night, like most people do, compresses bones together there as well. So what I'm going to have him do is hook his fingers in the inside, and he's going to put pressure outward on that jaw. Because there's usually a couple issues. One is the metal retainer, and the other is that from having braces on so long, everything's just kind of squished together and it's not moving how it's supposed to. So hook those thumbs in there and pull that apart. So we'll check this super strong one here. Hold tight. That one's very strong. Take that out once. I just want to show you again what it's like when he doesn't have it. So drop that just a little bit. Hold on. Right there. Hold tight right there. And he gets really ratchety. Hold tight. Hard as you can. Really ratchety. Go up and do that again. And then hold tight here. And he gets very, very strong, and I can kind of pulse that, and it's very strong. So it's another case, you can take that off. It's just another case where in him, he's losing all this power down here. And it's also going to be affecting that right jaw, so we have to work on that too. He has a compression that kind of happens right through this side of his head, which is pretty common. So if we put pressure on the back side here, compared to this side, which was worse, this one?
Yeah.
Right? So the right side is way worse than the left side. There's some other nuances as well. So just wanted to show you yet another case of that. We have to be aware of that with braces, retainers, and things because, like I said, in many videos, these bones have to move. And they have to have freedom of motion. And you never know what's going to happen from that if you don't learn it and you don't see it. It could be shoulder issues, it could be compartment syndrome in the leg, feet not working right, jaw clicking, any number of things.